Hi everyone, welcome back to my channel. Today I'm going to be talking about Psychology Unit 13, which is all about treatment of psychological disorders. If you haven't seen my Unit 12 video about psychological disorders, I would watch that first so you can understand this video. Philip Pinel and Dorothea Dix, they led the movement to go from harsh treatments to softer treatments. They fought for mental patients to be moved from prison to mental hospitals. And then after their time at the mental hospital, they thought they could be treated from home with support groups and medication. Psychoanalysis is talking therapy that investigates the interaction between the conscious and the unconscious. Free association is when a person speaks freely without interruption. This is used to discover unconscious thoughts and feelings. Resistance is suppressing something they do not want to surface. This happens during free association when they stop talking. Transference is unconsciously projecting feelings from past relationships onto the therapist. This could be like when a patient is talking about their abuse they received from their parents and then getting angry at their therapist. Humanistic therapy is also known as insight therapy. It's when you focus on the present, not the past. I know a lot of therapists talk about things that happen in your childhood, but that's not humanistic therapy. It focuses on the conscious and not the unconscious. It's when you take responsibility for your own actions, not blaming the unconscious. And the goal for humanistic therapy is not to be cured, but it's to grow as a person. Client-centered therapy is when the therapist does active listening and gives unconditional positive regard to the client, which would basically mean no judgment. And what they'll do is they'll paraphrase what the client has said to them, and then they'll repeat it back as a question and look for the approval that that's what the client wanted to convey. Behavior therapy. Counter conditioning is pairing a trigger stimulus with a new response. Exposure therapy is exposing people to the things they fear and avoid. For example, if you have a fear of spiders, you could start by holding a small, harmless spider and then eventually get over that fear. Virtual reality exposure is a simulation of fears. You would wear a headset like this one. And for example, if you have a fear of heights, it can simulate you standing at the top of a very tall building to help you get over that fear. Systematic desensitization is using baby steps while remaining calm. So it's said that you can't be calm and anxious at the same time. So what you'll do is get in a really calm state of mind and then get to the very first step of that fear that you have. For example, if you have test taking anxiety, you would get in a very calm state of mind, and then, for example, the first step could be like finding out you have a test. And then if you remain calm while imagining that, then you would move on to the next step. But you can't move on to the next step until you remain calm. There are many different types of therapists. Counselors, they help people overcome challenges through guidance. Social workers, they connect clients with resources and assist with challenges. And then clinical psychologists and psychiatrists, they diagnose and treat mental disorders. For biological disorders, you always want to start with the least invasive treatment, which would be drugs. And then if the drugs don't work, you would move on to ECT, which is electroconvulsive therapy. It's when an electrical current is used to induce a seizure. If that doesn't work, then you would go to using magnets to stimulate areas of the brain. If that doesn't work, you would go to psychosurgery, which is surgery that alters the brain. You would never start with psychosurgery because that's very invasive and unethical to start with. So you would always start with drugs and then work your way up if nothing else works. And then drug therapies. Anti-anxiety drugs are Xanax, Ativan. Antidepressants are Paxil. Mood stabilizers would be lithium and Depakote. And that's it for Unit 13 of Psychology. Be sure to like and subscribe for more, and thank you for watching.